Magandang araw po sa inyong lahat and welcome once again to another pre-recorded video lecture for the subject NCM 107, Care of the Mother, the Child, and the Adolescent. My name is Jeffrey Reboron and we will be discussing the different systems of the neonate. So please bring out your notebooks and your ball pens so you can follow along our discussion. Maraming salamat po and let's start our lesson. It's now time for us to discuss our next lesson, which will focus on the newborn assessment. Now again, as midwives, it is our responsibility to always assess the newborn. Okay? Dapat po alam natin yung mga normal from the abnormal signs so that we can easily detect if there are problems that arise to the patients that we are handling. Okay, so in this module or in this lesson, you will be more familiar with the systems of the neonate. All right. So the first thing that we're going to look at is the cardiovascular system. Okay, so this involves your blood vessels. It involves the oxygenation of our blood. Okay? Now, always remember na magkaiba po yung oxygenation of blood for both fetus and the neonate. Okay, so gaya ng napag-aralan natin last time, the center for oxygenation for the fetus is the placenta. Doon po nanggagaling yung oxygenated blood natin. But in the neonate, ang nangyayari po pag yung bata nakalabas na from the uterus, okay, the child is not anymore dependent of the placenta. So anong gagawin na niya? Since wala na siyang supply ng oxygen coming from the placenta because we will be cutting it already. Anong mangyayari? Okay? The newborn will shift the center of oxygenation from the placenta in the intrauterine life to the lungs after birth. So isa yan sa mga malaking major na changes that happens when the child is delivered. Okay? So nag-iiba po yung center of oxygenation. From the placenta, gagamitin na ni newborn yung kanyang lungs after that. Alright? Next, always remember that when the cord is clamped, the newborn is forced to take in the oxygen via the lungs. Okay? Once nga inrugita yung in-clamp day jay umbilical cord din, kung nananto day ubing ni, bakit wala na akong source of energy, source of oxygen? So, ang mangyayari, mapipilitan ngayon si newborn na gamitin na yung kanyang lungs. So, when the cord is clamped, remember that, the newborn is forced to take in oxygen using his or her own lungs. Alright. I hope that you are already familiar with the fetal circulation because I already sent a video last week and I know that you are also familiar with the difference of the fetal circulation and the neonatal circulation. So, napag-aralan natin last time yung mga different accessory structures na makikita natin sa fetal circulation pero hindi natin makikita sa neonatal circulation. If you have problems when it comes to understanding that, you can just refer to the videos that I sent last time. Okay? Now, ito yon yung neonatal circulation. Yung isa naman is the fetal circulation. Ngayong amuyo detan. In-explain na po ng ating video yan. Pero joke lang, hanang mamumakan niyo because I really miss having lectures with you all. Okay, so that concludes the cardiovascular system. Okay? Or the circulation or oxygenation of the blood. Ang next naman natin natitignan is the blood values, okay, of the neonate. Always remember that the normal blood volume or kung gaano karaming dugo ng isang bata is 80 to 110 ml per kilogram of body weight. Or approximately, the newborn, when they are newly delivered, kapag kapapanganak pa lamang ni newborn po, they have approximately 300 ml of blood. Okay? Now, ano yung pinaka-importante dapat na matutunan natin dito when it comes to the blood values? Yung WBC po ng bata, the normal value of it is 15,000 to 45,000 WBC per cubic millimeter. Okay, that's the normal. Pero, yung bata po, pag siya ay pinanganak, okay, anong nangyayari? Because the child has been exposed to trauma of birth dahil sa naipit-ipit yung ulo niya during delivery and things like that, ang nangyayari, tumataas ngayon si WBC. It becomes more than 45,000 WBC per cubic millimeter dahil sa trauma of birth. Ngayon, we midwives and other health professionals find it difficult to differentiate kung bakit tumataas yung WBC. Laglagipan nyo pa yung mesa nga cause the increase of WBC is infection. Okay? Kaya sir, kasanutat na nga ro din, tumataas ang WBC pag may infection, tumataas din ang WBC because of trauma of birth. Now, what is the problem here? Ang problema po dito is that some of the health professionals will find it difficult to differentiate yung non-pathologic increase of WBC, kaya tayo nahihirapan na i-rule out si infection. Okay? Hindi kayo nasabihin tayo, sir, i-simplify natin. Di ba kung natayo tatay, ang WBC po tumataas pag may infection. Okay? Ang WBC din tumataas kung because of the trauma of birth. Ngayon, pag tumaas po yung WBC ng newborn, mahihirapan po tayo. Midwives, doctors, we will be hard up in differentiating the real cause of the increase in WBC. Is it because of infection? Or baka normal lang yan na trauma of birth? Diba? So that's the difficult thing about the increase in WBC because of trauma of birth. So pagtatanungin nyo, sir, niyang ortobrain ti doktore no nagpangato ti WBC di ubing, they still treat it as an infection. So pag yung bata po, tumataas yung kanyang WBC, immediately, we give them gentamicin or ampicillin. Those are antibiotics because we always assume na baka may infection yung bata. Alright? So, nagkakaintindihan po tayo doon, di ba? Okay. Now, we also have the term blood coagulation. Okay? When we say blood coagulation, it is also called blood clotting. Okay? Now, always remember na pag-aralan na natin po noon last time that infants have poor blood coagulation. Nahihirapan mag-clot ng dugo ng newborn. Bakit? Because they have a very low level of vitamin K or the phytomenadion. So, bakit, sir? Because of the sterile intestines. Okay? Laglagitan nyo the vitamin K is necessary for blood coagulation and it is synthesized by the intestinal flora. Dahil po sa konti lang or walang intestinal flora, yung intestines ng bata, wala pong nagsisynthesize ng vitamin K. So that's the reason why newborns will have problem when it comes to blood coagulation or blood clotting. Kaya tayo nag-i-inject ng vitamin K sa mga bata. So sabi dito, infants or newborns have low vitamin K because of sterile intestines, which is deficient in intestinal flora. Okay, this is the reason kung bakit tayo nagbibigay ng IM of vitamin K or the aquamephyton of 0.1 ml. Paki-change po yung nakikita nyo sa screen, 0.1 ml, and we inject it in the vastus lateralis immediately after birth to prevent what? To prevent bleeding. Kasi po si vitamin K, it is necessary for blood clotting or blood coagulation. Alright. Next, tignan naman natin yung respiratory system ng bata. Now, remember that the first breath of the child or the neonate takes a large amount of energy. So, narigat para kanya dati aganges or to initiate the first breath. Bakit po? Because of the sudden shift of the center of oxygenation from the placenta, kunan di ubing, naggapulang di placenta di oxygen ko tatayt, so nga nagrigat tungam, usaren di lungs na. So, because of the shifting of the center of oxygenation, the first breath will take a tremendous amount of effort from the child. Okay? So, dito ti mesang reason na aping nga marigatan da nga ag-establish the breathing. Another reason why the neonates or newborns will have difficulty initiating the first breath, narigat na ti umangis, di damo nga angis, narigat na nga aramiden, is because of the presence of fluids in the lungs. Anong tawag po sa mga fluids na yon? Ang tawag po sa mga fluids na yon ay amniotic fluid. Always remember po na immediately after delivery, yung lungs po ng bata, punong-puno pa rin po yan ng amniotic fluid. Okay? Iso nga narigat na pailaeng ti aganges de ubing. Okay? Because of the presence of fluids in the lungs. Next. Now, when it comes to newborns who are delivered via the normal spontaneous delivery or yung mga pinanganak po via the NSD, the fluid is forced out by the pressure of vaginal birth. Apay, di kad dejo ubingket magnamit di jayanti vagina. The newborn will pass the vagina. So what will happen? If the newborn is passing through the vagina, merong pressure po na nagaganap. Parang iniipit po ng vaginal walls yung chest ng bata. At dahil po sa pressure na yon, anong nangyayari? The fluids are being expelled. Kasi mapespes deji chest, deji ubing because of the vaginal delivery. Okay? And some of the additional fluids ng mabati will only be absorbed by the lung vessels. So nga, kaya nasawen detoy, when the newborn is delivered via NSD, nadardaras na ti aganges or aginishate the first breathing. Let's compare it to children who are delivered via cesarean section. Yung mga bata naman po who are delivered via cesarean section, their fluids in the lungs are not expelled thoroughly. Haanda nga maikat insigida deje fluids from the lungs apay. Kasi hindi naman po sila dumadaan sa vagina, kaya hindi po nako-compress yung kanilang chest. Now, they may have difficulty initiating their first breath because of excessive fluid that blocks air exchange space. So dahil walang compression na nagaganap dito sa chest, okay, hanga mapespes na dyan tibarukong da, hindi na ilalabas yung fluids in the lungs. Therefore, ano pong mangyayari? Nahihirapan po silang mag-breathe. So ano pong mas maganda? As much as possible, NSD babies, because they will not have difficulty initiating first breathing because the compression of the chest will facilitate the expulsion of the fluids in the lungs. Okay. Next po. Meron din tayong tinatawag na surfactants. And when you say surfactants, these are fluids that are found in the lungs which are necessary for alveolar inflation. Okay? Anya ti kayat na sa wendeto yapo. Ang surfactants po, these are necessary so that yung mga alveoli natin, ang alveoli po kasi, yun ay yung mga smallest unit of breathing that are found in the lungs. Ti mapasamak di alveoli, when we breathe, ag-expand, okay, mapuno dati angin, and then when we exhale, ag-decompress. Okay? Now, ti mapasamak po dita, yung surfactants po, necessary sila sa alveolar inflation. Anong ibig sabihin nito? Tinutulungan nila yung mga alveoli para ma-meet yung elasticity. Tano agangis ka? Okay, ag-open data. And then, ag-exhale. Kung wala po tayong surfactants, ano pong mangyayari? If we inhale, okay, puputok po yung mga alveoli. Okay? So, very important po yung surfactants that are found in the lungs because they are necessary for alveolar inflation. Ang tawag po natin sa mga dalawang surfactants na present sa ating lungs ay lecithin and sphingomyelin. Okay? In the board exams, lagi po nilang tinatanong kung ano ang ratio ng surfactants so that we can say that the surfactant level is normal. The answer to that question is 2:1. Masasabi lang po natin na normal level na yung surfactants natin if and only if there are 2 lecithin and 1 sphingomyelin. Nagkakaintindihan po ba? So surfactants are necessary for alveolar inflation kasi kung wala yung mga yan, anong mangyayari? Kung wala po ang ating surfactants, magkakaroon ng lung collapse or atelectasis. Apay, kasi nga pag mag-inhale tayo, puputok po yung mga alveoli. Okay? Remember po that surfactants are formed during the 7th month of intrauterine life. Anong ibig sabihin nito? Pag yung bata, nasa fetus pa lang, nasa loob pa lang ng sinapupunan, at pag 7 months na yung bata, okay, inside the womb of the mother, that is only the time na nagproproduce si surfactant. Na naproproduce si surfactants. Kaya nga po, yung mga bata na premature, na pinapanganak before 7 months, okay, ang mangyayari, namamatay sila. Bakit sila namamatay? Because of lung collapse or atelectasis. Bakit nagkakaroon ng lung collapse or atelectasis? Because of the lack of surfactant. So nga, lagi niyong tatandaan po yan ha, surfactant is necessary. It is produced on the 7th month of life. It is needed for alveolar inflation. Ano pa po? And kung wala po tayong surfactants, it leads to lung collapse or atelectasis. Okay. So clear naman po so far? Alright. Next, we also talk about the gastrointestinal system or the GIT. Now, the GIT, like we said last time, is sterile at birth. Okay? Wala pong mga microorganisms in the GIT kapag kapapanganak pa lang ng bata. Now, the bacteria will only enter your gastrointestinal tract through the child's mouth kasi rugyan ng tumitenti aganges the external environment. Ano pa? Dadaan siya kasi sa vagina. And the vagina is also full of microorganisms. And contact to beddings and breast. So, amalan na di ubing di beddings, amalan na di breast, may mga microorganisms po yun doon. So, anong mangyayari po sa sterile na intestines? Mapupuno na po siya ng bacteria. Okay. So, maganda ba yun or hindi? Maganda po yun. Because the bacteria that are present in the gastrointestinal tract are necessary for digestion as well as vitamin K synthesis. Ito po yung tinatawag natin na intestinal microflora. Kailangan po yang ng katawan both for digestion and for the production of vitamin K. Now, ang usually na laman po ng gastrointestinal system is the breast milk. Okay? It is the main food of the infant. But remember po, na kahit na kompletong-kompleto po ang breast milk para sa bata, remember that it does not contain vitamin K. Okay? So saan manggagaling si vitamin K? Manggagaling po siya sa intestinal microflora na iproproduce po yun. Okay? Yung vitamin na yon. Now, remember that the newborn's stomach can hold only up to 60 to 90 ml of food. Okay? No, deta mesa baso ket 250 ml, you divide it into 3, tas jay laeng apo ka adu ti mainom de jay ubing. Okay? Or makarga de jay stomach na. Their stomach can only hold up to 60 to 90 ml of food and fluid. Now, kung mapupuno po yun, yung stomach, more than 90 ml, ang mangyayari po is there is regurgitation. When you say regurgitation, in Ilocano, it means bila. Okay? Or birwa, kung nadarizay. It refers to the backflow of food from the stomach to the mouth. Okay? Nung makita yun, di ubing, ala na, adwa na, gatas na. Makita yun ton, adarumrumwar nga gatas, jingiwat na. That is what we call regurgitation. Okay po ba? So, lagi niyong tatandaan na dapat 60 to 90 ml of food and fluid lang po ang dapat kargahin ng tiyan ng bata, ng stomach ng bata. Okay po ba? Alright. Next. Remember po na yung regurgitation, it is common for neonates. Api kanya tayo, sir, kung mabsog tayo, kaya may agbira-bila. Okay? Kaya api dagi yung ubing kaya numapuno day dyan ti stomach doon kig bilada. Common po ito Common po ito sa mga neonates. Bakit? Because of the immaturity of the sphincter between the stomach and the esophagus. Laglagitan nyo og tilmon kayo ngamin, digiyan ti esophagus yo, at dapat ti sphincter na dijay. Okay? Aglukat, agrikep me lang suna. Okay? Before it reaches the stomach. Okay? So yung sphincter na yon immature pa lang po. So dahil sa immature pa lang siya, pag nag-open, ay talagang naka-open siya. Kaya mabilis mag-regurgitate po ng food from the stomach to the esophagus. Okay. We also talk about the pancreas and the liver. Okay. Remember that the pancreas and liver have low enzyme production due to immaturity. Kaya nasabi na po dito, hanpay langag-produce unay ti insulin. Dito nga pancreas and liver handet nga produce ti bile. Bakit? Kasi immature pa lang po sila. And the body does not need that amount of insulin and bile pailaing agaputi pancreas can liver. Bakit? Kasi hindi pa naman kumakain po yung bata ng matatamis na pagkain. Hindi naman po siya kumakain ng matatabang pagkain para kailanganin niya ng insulin at bile. Okay? Because the breast milk is both very low in fats and very low in sugars. Okay? So laglagitan nyo, the pancreas and liver are still both inactive after delivery kasi immature pa lamang po sila. Okay. Now, yaman din lamang na napag-uusapan na natin ang gastrointestinal system, pag-usapan naman po natin yung types of stool. Okay? Because as midwives, pinag-aaralan natin talaga yan. Yung mga tae-tae na yan, pinag-aaralan natin yan. Now, the first type of stool that we will be talking about is meconium. Alam natin to. Meconium is the first stool of the neonate. It is sticky. Okay, napigget. It is star-like. Kasla kuma-espalto na nangisit. It is blackish-green in color and it is also odorless. Awan ti angot na. Now, remember that the meconium is formed from mucus, from the vernix caseosa, from the lanugo and carbohydrates that are swallowed by the fetus in the intrauterine life. Did gamin ubing, do di suna uneg ti matres ni nanang, agtilmo-tilmon me ngamin deta. So di matilmon na nga mucus, amniotic fluid, vernix caseosa, lanugo, and carbohydrates, they turn into meconium. Alright. Now, it is important that we monitor the delivery of the meconium. Dapat po tinitignan natin na yung meconium ay lumalabas within the first 24 hours after birth. Siguraduhin po natin na yung bata nakatae within the first 24 hours. Why? Because if the child fails to pass the meconium, no hangatim makip within the first 24 hours, what do? Report to the newborn. Report to the doctor. Report to the doctor immediately because the child may have imperforate anus. Baka hangatim makisuna within the first 24 hours kasi awan ti abot jay puriit na. That's what we call imperforate anus. The next type of stool is what we call the transitional stool. Kaya po siya tinawag na transitional stool kasi nagbabago na po yung tae ng bata. From meconium, nagiging milk stool na po siya. Nagets? Okay. So, transitional stool is usually colored green. It is also loose, medyo nabasa. Okay? Which may resemble diarrhea. And it is passed on the second to the third day of life. Apay, sir. Kasi dito intestines, di ba napuno meconium beta? No timmakki di ubing within the first 24 hours, rimwarji meconium, but there are still a trace amount of meconium that is seen in the intestines. And when the child will start to drink milk, may tipon to may nga takkin, di yan meconium, kaya po siya tinawag na transitional stool. Kaya po ang color niya is also green. Alright? Now, depende po sa gatas na iniinom ng bata, yung next na stools po natin. Okay? When we talk about breastfed babies, okay, they pass their stool 3 to 4 times per day. 3 hanggang 4 na beses silang tumatae sa isang araw pag sila ay breastfed. The color of their stool is light yellow. It is also sweet smelling. Hindi offensive yung odor ang nabanaal. Okay? And it is also soft, which are high in lactic acid. Okay? So 3 to 4 times a day nga tumakti di ubing, meaning naluning di takina. But if the child is bottle fed, okay? Mapapainom lang sunat ti matemplang nga gatas or what we call the formula milk. The newborn will only pass stool 2 to 3 times per day. Okay? The stool of bottle-fed babies is bright yellow. It is formed, okay, natangken, with more noticeable odor than with breastfed babies. So, ibig sabihin po, mas matapang yung amoy ng tae ng bata who are bottle-fed. So, kung makikita nyo, mas mahirap din pong itae or ipas ng bata yung bottle-fed. Okay? Na pag siya ay bottle-fed, mas mahihirapan siyang tumae because the stools are formed. Kumpara sa breastfed naman, the stools are soft. Okay? So, pansinin nyo, pag bottle-fed, 2 to 3 times per day lang. Pero pag breastfed, 3 to 4 times a day. So, mas maganda pa rin po pag yung bata ay breastfed compared sa bottle-fed newborn. So, ito po ang itsura ng meconium. Okay, greenish to blackish in color. Ito po ang itsura ng, yung may, una po is the transitional stool. That's the meconium. Dito po yung transitional stool. Kung makikita nyo, it's also blackish to greenish na may mga yellow-yellow na. Okay? This is the stool of breastfed babies. So makita nyo na basa. It's very soft. Ito naman yung stool ng mga bottle-fed babies. Okay? Yung isa light yellow, yung isa bright yellow, yung isa formed, yung isa soft. So, sinong kumakain dyan? Masarap bang kain? Alright. Next. When we talk about babies under phototherapy, yung mga bata na nilalagay nila sa phototherapy machine or yung pinapaarawan nila every day, they will pass bright green stools because of the increased bilirubin secretions in the stool. So, no tumaktido dagiting ubing because of the excess bilirubin that are found in the stools, ang mangyayari magko-color green po, bright green, yung stool ng mga babies under phototherapy. But if we talk about babies with milk allergy, the baby may pass stool which are combined with mucus. No ti ubing, ket digitakina, may mga parang mucus. Okay, kasla dati butig-butig na. That may mean that the child has milk allergy. In simple terms, in medical terms, I should say, we call this lactose intolerance. Okay po ba? So, malalaman natin kung meron siyang milk allergy pag merong mucus that are found in the stool. But if the child will pass gray-colored stool, okay, medyo gray color na, it is caused by bile duct obstruction. Mabalin nga di yan ti bile mo, meron siyang cyst, merong stone, kaya hindi nakakalabas yung bile. Liver ko na po mabaling nga di liver or di pancreas, that is stone na kaya hindi nakakalabas yung bile. So, always remember that the bile metabolizes fats and when the bile can enter the intestinal tract due to obstruction, nagkakaroon na ng gray color yung stool. Naglagay pa niyo dyan. Next, we also have the black tarry stool. Okay? When we talk about black tarry stool, kung kumakain po kayo ng black gulaman sa Chowking, yung parang gula-gulaman niya na color black, that's the appearance of the black tarry stool. Pag nakakita po tayo ng ganun ka-black na tae ng isang neonate or ng isang pasyente, that may mean that the person is experiencing internal bleeding. Okay? Pero usually, nakikita din natin ito sa mga bata on their second to the third day of life. Okay? Pero normal lang po yan. Okay? Bakit po? Because some of the neonates will be swallowing, okay, or accidentally swallow maternal blood. Makatilmunda ti dara from the vagina. So what happens? Kain nila yung dugo from the vagina and then dadaan yun sa stomach, which will mix with the the blood will get mixed with the hydrochloric acid. At anong mangyayari pag yung dugo na color red na lagyan ng suka, magiging magiging black ang color. Kaya po, minsan nakakakita tayo ng mga black tarry stool sa mga newborns on their second day of life pag sila ay nakaswallow ng maternal blood. Okay? Para naman po blood fleck stool, color yellow, pero may mga red na flecks yung kanyang tae. That indicates anal fissure. Kaya nasa Mendejay, baka meron pong sugat sa may anal sphincter ng bata. Kaya doon siya nagdudugo. Okay? So let's look at the picture. Babies under phototherapy, yung tae nila nagiging bright green in color. Babies with milk allergy, makita nyo meron mucus sa kanyang stool. Okay? Gray-colored stool. Okay, yan ay nakikita natin sa mga patients with bile duct obstruction. Okay? Black tarry stool, nakikita natin yan sa internal bleeding or for newborns who swallowed maternal blood. And then blood fleck stool, dito na tae na may konting dugo po dito, baaring anal fissure. Napadasan yung nagtabelen, tapos nakatangtang kenji tabelyo, tapos marinayo, kasi nasugat di po riityo, and then nadatidara na. Ganun po yung anal fissure. Okay, blood fleck stool ang tawag po natin doon. Alright, we also talk about the urinary system. Always remember that, like in the gastrointestinal system, the newborn should also void within the first 24 hours after birth. Yan po yung normal. Dapat umihi yung bata on the first 24 hours of life. Okay? Now, if there is anuria or absence of urine, maaari pong it is caused by the decreased fluid intake of the neonate, which may delay voiding. Mabalin nga di jubing, han nga umisbo pa'y insigida isunap if you had trouble initiating breastfeeding. Okay? So hindi nyo po napainom agad ng breast milk yung bata, maaaring magkaroon po siya ng anuria within the first 24 hours. Next, kung nakakakita po kayo ng anuria or absence of urine, nagbayagin nga umispo ito ubingin na pagdedemimetten. Pag hindi po pa rin umiihi yung bata, but you have already initiated breastfeeding, you have to check for stenosis or absence of ureters. Bakit di kulang yung kanyang urinary system, kaya hindi po nakakalabas yung urine. Alright? So report immediately to the doctor if that happens. Next, pag-usapan din po natin kung paano umihi yung bata. Okay, we observe the urinary stream or kung ano yung itsura ng pag-ihi ng bata for possible obstruction of the urinary tract. Okay, for male newborns or for males in general, ang ihi dapat is small projected stream. Kung iihi ka man, ganun. Konti lang po yung projection. Okay. Ang abnormal po na urinary stream is what we call strong arching projection. Okay? Yung strong arching projection, umisbo ka kaya nagpigsa, nagadayuti, pakadanunan na dayjay, isbo. Okay? That indicates obstruction. Baka merong cyst or baka merong pagsikip sa inyong mga urinary meatus. Pansinin nyo yung hose ng tubig, pag open lang yon, yung kanyang stream, ganun lang, normal lang. Konti lang, small projected stream lang. Pero pag kinover mo yung half ng opening, ang mangyayari lumalakas yung pressure. Nagkakaroon ng strong arching projection. Parang ganun din sa urinary stream ng mga lalaki. Pag strong arching projection, that indicates obstruction of the urinary meatus. For females naman po, ang normal po ay steady stream. No, misbo kayo, kasalaso na ilog na dumadaloy. Unanalaeng. But, for abnormal na urinary stream, it's continuous dribbling. When you say continuous dribbling, kasla ko masu na gripo nga, hanyong mairikip nga na siya at agted-ted-ted nga dire-diretso. That's an abnormal urinary stream for females. Okay, ang normal po, steady stream. Okay, dumadaloy siya ng parang ilog. Steady. Okay, so the urine is usually light in color. Light in color because the kidneys cannot yet concentrate the urine, okay, within the first 24 hours. The normal urine output is 30 to 60 ml per hour for the first 2 days. Lagita tilaglagitan niyo, okay? Now, ganyan po yung itsura ng urinary stream, both normal and abnormal. Yung mas malaki po, that's the normal urinary stream. Ito po. Ganyan po dapat yung itsura ng urinary stream. Very small lang po yung projection. Pero pag ganito po kalaki yung urinary stream mo, that means a strong arching projection and that may mean that there is a presence of obstruction. Ito naman po pag steady stream, naka-open siya. Pero pag continuous dribbling, kasala-sarasabipitin nga dire-diretso magtintin nagti-isbuna. So that's the normal and abnormal urinary stream for both male and female patients. Next, this will be my last topic for today, and after this, you will have a quiz, which I will be uploading this Saturday. Or no, tomorrow. I will be uploading it tomorrow. You can take the quiz until Saturday. Okay, we talk about the autoimmune system. Okay, always remember that newborns have difficulty forming their antibodies, okay, against infection up until 2 months. Nakapoy pailaing tikired de ubing. The child may have difficulty forming their own antibodies because their lymphatic system are still inactive or immature. Kaya nga po yung mga bata, kailangan nila ng vaccination. Kailangan nila ng colostrum because these will provide them with the necessary protection against infection. Kasi nga, nahihirapan silang mag-form ng antibodies on the first 2 months of life. Now, meron tayong tinatawag na immunoglobulin G. Naibagak man dito yung last time. When we talk about immunoglobulin G, these are antibodies that are from the mother which cross the placenta during the intrauterine life. Okay? Pag 8 months na buntis si nanay, ang nangyayari po, kunanan to DJ bagi di maderene, dandani may pusingin, deto'y anak ko. Malapit nang lumabas si baby. So what will the mother say? Sasabihin ng katawan ng nanay, I know baby that during the first 2 months of life, you will have difficulty forming your own antibodies. So I will be sending some of my immunoglobulins to you so that you will be protected once I deliver you. Kunana. Okay? So what will happen? The immunoglobulins or the antibodies that are present in the body of the mother, they will now cross the placenta going towards the fetus. Para pag lumabas yung bata, meron na siyang antibodies na nakuha from the mother to protect him on the first 2 months of life. Ang ganda, di ba? Kasi hindi ka pa pinapanganak ng nanay mo, binibigyan ka na niya ng protection. Alright. Next, we also have what we call colostrum. Pag sinabi po natin colostrum, these are clear, light yellow milk which is initially produced by the mother. In simple terms, ito po yung unang gatas na inilalabas ng nanay. And the colostrum is rich in antibodies which will also protect the neonate on the first 2 months of life. Di ba? So habang hinihintay pa yung mga ibang vaccination, protected na po ng nanay yung kanyang baby kahit na nahihirapan pa si baby na mag-form ng kanyang antibodies. So the reason that you are alive right now is because of the protection of your mother. Idiubing kayo, you were prone to having infection. Kasi nga, nahihirapan kayong mag-form ng antibodies for the first 2 months. Pero nakasurvive kayo. Bakit? Because of the immunoglobulin that crossed the placenta and because of the colostrum that was produced by your mother, which are both rich in antibodies. So dapat nagte-thank you kayo sa inyong mga magulang dahil without them, you couldn't have survived the infection that may have occurred on the first 2 months of life. Nagkakaintindihan po ba? Alright. Next, meron tayong tinatawag na types of immunity. Pero bago natin po pag-usapan yung types of immunity, alamin po muna natin ang tinatawag natin na antigen versus antibody. Okay. Pag sinabi po nating antibody, ito po yung good guys. These are the immunoglobulins, okay, that are present in our body that prevent or protect us from infection. Antibody. Okay? Short for anti-foreign body. Nagets po ba? Next, ang second term naman natin na i-define is what we call antigen. Pag sinabi nating antigen, these are the bad guys. These are the ones that produce diseases in our body. So your antigen may be in a form of bacteria, a virus, basta anything that can trigger the production of the antibody. Okay? So alam na po natin yan ha, antigen, bad guy, antibody, good guys. Okay po ba? Alright. Now, pag-usapan natin yung types of immunity. When we say natural or innate immunity, these come from the body's sources. Meaning, katawan natin mismo ang gumawa ng immunity na yon. But when we talk about artificial antibody, malamang it is the opposite of the natural immunity. These are immunity that come from a synthetic source. Maaaring nanggaling sa laboratories, nanggaling sa mga yung pharmaceutical companies, artificial immunity po ang tawag natin doon. Next, we also have active immunity. Pag sinabi nating active immunity, our body develops that certain immunity. Mismong tayo ang nag-produce ng antibody na yon after an exposure to a certain disease. Okay? Pero pag sinabi nating passive immunity, hindi tayo ang gumawa ng antibody na yon, but we receive it, we readily receive the antibody. Okay po ba? So that's the difference ha, natural, artificial, active, and passive. Now, when we talk about natural, active immunity, ang examples po nito ay chickenpox. Paano po nangyayari yon? Example ha, example, tingin na lang dito, wag na po sa ating slides. Tingin dito. Kunwari, yung isang tao nagkaroon siya ng chickenpox. So meaning, yung antigen ng chickenpox pumasok sa katawan niya. Okay? So yung antigen na yon, kung na napagsakitin ka, kung na nakaligibagi. So what will happen? The body will form the antibody against that antigen. Meaning, mag-produce yung katawan ko ng antibody against that chickenpox antigen. Nagets po ba? So, dahil sa example na yon, ako mismo ang gumawa ng sarili kong immunity or antibody. Okay? Na nangyari yon because I had exposure to that certain antigen. Nagets? Kaya siya tinawag na natural active. Kasi natural na paraan ko siyang produce yung antibody at ako mismo ang gumawa ng antibody na yon para malabanan yung sakit na chickenpox. So what will happen? No, dan tumanti umayan nga agtuko, oray no ipasa na kanyak beji nga antigen, I will not anymore be affected because I already have the antibody. Okay, so that's the natural active. Pag sinabi naman po nating natural passive, ito po yung mga antibodies na hindi natin produce, pero galing sa ibang tao. Okay? Ang good example nito, yung diniscuss ko kanina, colostrum, and the IgG coming from the placenta. Kasi, yung colostrum na yon may antibody. Yung IgG na yon coming from the placenta, they are also form of antibodies. Pero, ginawa mo ba yon? Hindi. Ginawa po yun ng nanay mo na pinasa niya lang sa'yo. So it came from a natural source kasi galing sa nanay mo, but you did not produce the antibody on your own, it was produced by another person, which was passed to you. Colostrum and IgG are the perfect example of the natural passive immunity. Galing sa natural na paraan, pero hindi ikaw yung gumawa, ipinasa lang sa'yo. Natural passive. Sa natural active na vaccine naman po, galing sa natural na paraan at ikaw mismo ang gumawa ng antibody. Nagets po ba? Simple, di ba? Okay. We also have the artificial active. Sa artificial active naman po, ang isang good example nito is your vaccines. Okay. Alam niyo po ba na yung COVID vaccine, ini-injectan po kayo doon ng mga live COVID virus. Listen, nakabuting met. Normal lang po yun. Because when we talk about vaccines, these are attenuated microorganisms. At yung mga attenuated microorganisms, yun po yung mga buhay na antigen, but they do not have the ability to render you sick or ill. Okay? Isungarod nyo, nagpabakuna kayo, di ba nagpabakuna kayo, BCG, kada ko kay agurigur kunada. Yes, agurgurigur kayo because those antigen that are injected to you via the vaccine are causing you to react to their presence. So yung antigen nga intudok-daking ka, sikan to timang producer ti sarili mo nga antibody, no. Nudumting di ususto nga sakit king ka, you already formed that antibody. You already are protected. So that is your artificial active immunity. Intudok-daking ka, coming from an artificial source. Okay? And then ikaw mismo, idi-intudok na kang kadayja, yung antigen mismo, trigger niya yung immune response mo, ikaw na din mismo yung nag-produce ng sarili mong antibody. Okay, example ko measles vaccine. Nagpatawa pa iti measles ko tinudukan takti anti-measles vaccine. So what happens? Intudok na kanyak kadayja antigen, and then my body reacted to it. Nag-fever na pagbiit, and then after that, na-produce ko di antibody. Tata na dati kasinsin ko nga agkamuras, ag-measles. What happens? Hindi nag-measles si Suna, inakaranak. Pero, hindi na niya ako ma-i-infect because I already have the antibody. Kasi nagbakuna na ako. So, artificial, galing sa bakuna, pero ikaw mismo ang nag-produce, so artificial active. Next, ito po yung last is what we call the artificial passive. Yung artificial passive naman po, tinudok sa'yo, galing sa other source, pero hindi na ikaw yung mag-produce ng antibody. Ang ibibigay na lang po sa'yo is antibody na galing na din po sa laboratory. Na-gets? Amo yung difference sa ti antigen ken antibody niya. No artificial active, ti itudok na king ka, it is an antigen. Tudok na dyan antigen, sikatig produce ti antibody. No artificial passive net, handa ka nga tudukan ti antigen. Ti itudok na king kan antibody. Gets? Okay. So example po ng artificial passive natin is what we call anti-serum. Yung anti-serum po or anti-rabies, mabalin pa dyan, nakagat ka, ti aso, ti itudok na king ka is not anymore a rabies antigen. Ang ituturok na lang sa'yo ay rabies, anti-rabies antibody. Tano dito nga antibody timang patayan di rabies na baging. Okay. Another example is no nakagat ka kumati uleg, antitoxins. Okay? Yun na po, yung digi itudok na king kanti mismo mang patayen kadejay nga toxins that are found in your body. So those are the different types of immunity, and I guess that ends my lecture.
And that ends our pre-recorded video lecture for the subject NCM 107, Care of the Mother, the Child, and the Adolescent. At nawa ay marami kayong natutunan regarding the review of systems of the neonates. Again, please visit your Google Classroom because I will now be uploading your quiz for this session. Thank you so much and enjoy the rest of the day.